For most people, anesthesia feels like a switch. You're awake, we tell you to take some nice deep breaths, and next thing you know, you're waking up again. No memory of it, and no sense of time passing. But the truth is, anesthesia is not a switch. It's more like a dimmer, and sliding that dimmer too far can have some real consequences. So what actually happens if we give you too much anesthesia? And how close to that edge do anesthesiologists really work? Well, let's find out. First things first, anesthesia is not just one thing. It's not a single on-off state like a light switch. It's a combination of effects produced by multiple drugs working on different parts of the nervous system. One drug turns down awareness, meaning your ability to form memories and consciously experience what's happening. Another blunts pain signals before they even reach the brain. Another prevents movement by quieting the spinal cord and motor pathways. Think of it like dimming the lights in different rooms of the brain. Some rooms need to be very dark, while others just need to be a little bit dim. The goal is not to have pitch black everywhere. The goal is just dark enough in the right places for surgery to be safe and painless. The challenge is that the brain doesn't come with labels. We can't see these rooms directly. We have to infer what's happening based on physiology, what our monitors are telling us, and a lot of experience. Too much anesthesia doesn't usually mean you never wake up. That's a common fear, but it's not how overdose typically shows up in the operating room. What it really means is that we start interfering with the body's ability to keep its most important cells alive. Every organ in your body is made of trillions of cells, and every one of those cells needs the same two things all day, every day, forever. A steady supply of oxygen coming in and a way to get rid of carbon dioxide going out. If either of those stop for long enough, cells begin to fail. And when cells fail in organs like the heart or the brain, the consequences are pretty serious. Those are the organs that matter most to survival and quality of life. Oxygen delivery and carbon dioxide removal both depend on blood flow. The blood needs to be stuffed full of fresh oxygen, and it needs to be moving to get to all those cells. So when we talk about too much anesthesia, what we're really talking about is suppression of the systems that make that possible. 1, breathing, which loads the blood with oxygen and clears carbon dioxide, and 2, blood pressure, which pushes that oxygen-rich blood to the tissues that need it most. That's why the danger of too much anesthesia isn't theoretical, it's physiological. If breathing drops too much, the blood loses oxygen. If blood pressure falls too far, that oxygen doesn't reach the heart or brain effectively. And that's the line anesthesiologists are constantly working. Not just whether you're asleep, but whether every critical cell in your body is still being fed and cleared second by second. At higher doses, anesthetic drugs shut down the brain's drive to breathe. The signal from your brainstem that says, "Hey, take the next breath," just goes quiet. During general anesthesia, that's expected. It's why we place breathing tubes or airway devices and take over ventilation for you. The machine breathes for you while your brain rests. But if anesthesia goes deeper than intended, the margin for error shrinks. Oxygen levels can fall faster, carbon dioxide can rise faster, and small problems can become big ones more quickly. This is why airway control, oxygen delivery, and ventilation are such a central focus of anesthesia training. And it's also why anesthesia outside the operating room is treated with so much caution. Most anesthetic drugs relax blood vessels and reduce how strongly the heart pumps. That combination results in a lowering of blood pressure. A mild drop is usually harmless. We pretty much expect it in almost every case. But too much anesthesia can cause blood pressure to fall further and stay low longer than might be safe. Low blood pressure means less blood flow to vital organs like the brain, kidneys, and heart. If that reduced flow lasts long enough, the risks of organ injury begin to rise. This is why, if you've ever seen an anesthesia provider at work, you know we're constantly adjusting fluids, medications, and anesthetic depth. We're not just reacting once, it's a continuous balancing act, minute to minute. Now here's the part that still feels a little sci-fi, even to people who work in this field. At very deep levels, Anesthesia can suppress large portions of brain activity almost completely. On brain monitors, this shows up as something called burst suppression. You see long, flat lines of electrical silence interrupted by short bursts of activity. This isn't the same as normal sleep. It's not even deep sleep. It's a profoundly suppressed brain state, closer to temporary electrical shutdown. In some situations, like severe brain injury or refractory seizures, we sometimes induce this quiet brain state intentionally. But during routine surgery, going this deep unintentionally isn't really ideal. In older adults and critically ill patients, spending too much time at this depth has been associated with postoperative delirium, cognitive dysfunction, and longer recoveries. And those are just a few of the reasons why modern anesthesia generally aims for the lightest depth that still keeps you safe and unaware of what's happening during your surgery. Well, this is where anesthesia stops being theoretical and reality gets kind of messy. Different patients need different amounts of anesthesia. Age matters, body composition matters, genetics matter, chronic illnesses matter, alcohol use matters, the medications you take matters, even your hair color matters. And the effects of the surgery itself on your body aren't constant the whole time. For example, if the surgeon is just painting your skin with iodine to prevent infections, that's minimally stimulating at best. But when they're making incisions or trying to set broken bones, that's extremely stimulating and can activate all kinds of reflexes in the body that affect blood pressure and your level of anesthetic depth. The right dose often changes minute by minute, even in the same patient. If we underdose, the risk is awareness, pain, or movement during surgery. Overdose, and we risk suppressing good blood flow to your vital organs. Our job exists in that narrow middle, constantly adjusting as the situation changes. The short answer is that we don't just rely on a single monitor or a single number. We watch blood pressure, heart rate, oxygen levels, carbon dioxide levels, body temperature, breathing mechanics, anesthetic concentrations, and sometimes even direct brain activity. Each monitor gives us a different piece of the puzzle. We're adjusting medications continuously, sometimes every few seconds, to keep everything in balance. This is why anesthesia is a full-time physician specialty, not a background task. It requires continuous attention and anticipation. Organizations like the American Society of Anesthesiologists focus heavily on standards, redundant monitoring, and safety systems specifically designed to catch problems early before they become too dangerous. So now you know that too much anesthesia is dangerous, and that too little anesthesia is dangerous. That's why modern anesthesia is about precision, using just enough medication to protect your brain from awareness, block pain, prevent movement, and keep your body stable without pushing any system further than it needs to go. If anesthesia were simple, it wouldn't require someone sitting with you in the operating room for the entire surgery, just watching you and anticipating changes or problems. And the truth is, when anesthesia works perfectly, you never even notice how close to the edge we are sometimes. But that invisibility is not an accident. It's the result of constant vigilance and thousands of small decisions made on your behalf. Hey guys, don't forget to send me any questions you have about anesthesia in the comments section. Or if you have ideas for something you'd like to see me talk about in a future video. I'm really grateful to everyone who watches my videos and helps the channel grow. So thanks for watching, and I'll see you in the next one.